My name is Kathleen Nemer, and I'm a dermatologist and Mohs surgeon practicing in St. Louis, Missouri at Laser and Dermatologic Skin Surgery Center. Today I'm going to talk to you about the most common types of skin cancer and how you can spot them. Okay, here we go. The three most common types of skin cancer are basal cell carcinoma, squamous cell carcinoma, and melanoma. Tanning can increase the risk of all of these skin cancers. So the next time you're thinking about getting that golden glow, you may take a moment to think twice about what you're paying for. We're going to start with basal cell carcinoma. Basal cell carcinoma is the most common skin cancer. It frequently develops in people who have fair skin. People who have darker skin can also get basal cell carcinoma as well. Basal cell carcinomas often look like a skin-colored round growth, a pink pearly bump, or a pinkish patch of skin that does not go away. They can have this pearly look to them, and you can see some photos here that's kind of shiny, and they can also have blood vessels in them that feed the skin cancer, and these are the little red lines that you see in these photos. Basal cells usually develop after years of sun exposure and or indoor tanning. They are most commonly found on the head and neck, the ears, the arms, but it can be found anywhere on the body, including the legs, the chest, and the back. Early diagnosis and treatment of basal cell carcinoma is important because while they're slow growing, they can grow to become locally destructive, and they can grow deep, penetrating nerves and bones, and can cause damage and disfigurement. The next skin cancer we're going to discuss is squamous cell carcinoma. This is the second most common type of skin cancer. Squamous cell carcinomas also frequently develop in areas of chronic sun exposure in people who have fair skin. These look like a pink firm bump, a scaly patch, or a sore that does not heal. They can often be tender and grow quickly. As I mentioned, they form in areas of frequent sun exposure like the face, the ears, the hands, and the arms. But again, just like basal cell carcinoma, they can develop anywhere on the body, including the legs and the back and the chest. Early diagnosis and treatment of squamous cell carcinoma is also very important because they can grow deep and they can grow rapidly and they can spread to other parts of the body. Before we move on to the next type of skin cancer, I want to take a moment to talk about a pre-skin cancerous growth called actinic keratoses. Now, if you've ever visited your dermatologist, you may have encountered these because they're quite common. These are pre-skin cancerous growths, and if allowed to develop, they can turn into squamous cell skin cancer. They often look like dry, scaly patches of skin. You can see examples of them here. And oftentimes you can sometimes feel them better than you can see them. So if you're rubbing your hand over your face, you could feel like a little bump or something that looks scaly. That could be an actinic keratosis. And while they are not skin cancer, they are important to treat because they can develop into the squamous cell skin cancers. There are multiple ways to treat these, the most common being liquid nitrogen therapy, which is the freezing mechanism, which some of you may have experienced in the office of your dermatologist. Other ways to treat these are topical creams and light therapy. Now we're going to review the third most common type of skin cancer, which is melanoma. And this is often the most dangerous type of skin cancer because it has the ability to spread. Melanomas can develop within an existing mole, or they can develop in a new mole that arises that you've noticed that looks like a dark spot, different from the rest of the moles on your skin. Early diagnosis and treatment is critical to prevent melanoma from spreading to other parts of your body. We're going to review the ABCDEs of melanoma to help you spot a melanoma in its early phases and have it removed and treated. A stands for asymmetry. So one half of the mole does not match the other. You can see in this photo is a melanoma. You can see here that it is asymmetrical. It's not a perfect round circle. B is for border irregularity. You can see in this photo that the edges are ragged, notched, kind of blurry. They're not smooth. C is for color. The color of melanomas often vary within the mole itself. So you can have shades of light brown, dark brown, and red and pink, just like you see in this photo. Melanomas, the D is for diameter, and melanomas are oftentimes more than 6 millimeters, which is the size of an eraser on a number 2 pencil. And while this is a general rule, you can still have melanomas that are smaller than this. And E is for evolution. So this means that the mole is changing over time and it looks different than it has in the past or from your other moles. And sometimes we call this the ugly duckling phenomenon, where it's a mole that just doesn't look quite right. It doesn't look like your other moles. So I'd like to conclude by encouraging all of you to wear sunscreen, because that is one of the most important things you can do to protect yourself from the sun and from getting skin cancer. In addition to sunscreen, you can wear photoprotective clothing like hats and long sleeves and UPF clothing. I wanted to highlight one of my favorite sunscreens here, which is called Elta MD. And Elta MD has a line of sunscreens, and some are tinted, so they have a nice bronzing effect, and some are non-tinted. Here I've showcased the UV Clear on the left, which has a tinted and a non-tinted version. Next is the UV Daily. And then on the other side is the UV Elements and the UV Physical. So what's most important is that you find a sunscreen that you like and that you're going to wear, because that's the more important aspect, is that you wear it. And now I can take any questions that you may have. Don't see any questions. Oh, here's some questions. Okay, let's see. How often should a person have a skin check? That depends on who you are and how many skin cancers you had. So generally, once you hit about age 40, you should get a skin check about once a year. But if you have not ever had skin cancer before, you can talk to your dermatologist about how often they think you should come. Now, if you've had a lot of skin cancers, then sometimes you're going to come every 6 months or even every 3 months. So that sort of just depends on how often you get skin cancer, and that's something you'd want to talk to your dermatologist about. But if you've never had a skin check, you should probably get one just as a baseline. Let's see. What else we have? How much sunscreen should you use? Well, you want to apply enough to coat the skin. So, a thin layer would be appropriate, but the important aspect to that is that if you're sweating outside, you're going to need to reapply. So even though you put it on at the beginning of the day, if you're outside working, it's hot, you're going to want to reapply multiple times because you could sweat it off. The same thing as if you're getting in a pool, you could, even though they say that they're waterproof, some of it can still come off in the pool. So you should be just reapplying consistently. What else? Does the best sunscreen for us change as we age? Not necessarily. There are a few different types of sunscreen. The main two types are physical blocker sunscreens and chemical blocker sunscreens. So physical blocker sunscreens are made from zinc oxide and titanium dioxide. And those are the sunscreens that just sit on the top of your skin and there's no chemical reaction to make them effective. And those would be the safest type of sunscreen, and those would be the ones that I would recommend the highest. And Elta MD, which I mentioned, they have a lot of physical blocker sunscreens. Let's see. Oh, okay, this is a good one. I work in a basement and don't have much sun exposure. How often should I apply the sunscreen? Well, even if you work indoors, it would be advantageous to apply a sunscreen on your face every day. Because say you're going to go out and take a run to the grocery store, you're going to go pick up your child from school, you're going to be getting outside and in your car, and you're going to be getting some sun exposure. So even though you work inside, I would still recommend wearing a sunscreen, especially on the areas that are going to be exposed, like your face and your ears. Are there any home treatments for actinic keratosis? Yes, so there's multiple treatments for actinic keratosis. There are treatments we can do in the office, like the freezing with the liquid nitrogen. The other option or other options include a cream that you can do at home, and that's something you'd want to talk to your dermatologist about, and they can give you more information. Do you use different sunscreen on your face in the winter versus the summer? I personally do not. I think no matter what time of year it is, you should be wearing a sunscreen. And as I mentioned, I think the best type of sunscreen to put on your face would be a physical blocker sunscreen. And the two ingredients to look for are zinc oxide and titanium dioxide.
So as you know, I did want to kind of go over a lot of the questions that I get asked over and over and over again. And so hopefully this answers a lot of your questions. So let me know. I'm going to try and share my screen here. Hopefully everybody can see it. Okay, is that visible? Okay, let me know. All right, so let's get started. So probably the two most common questions I get asked are regarding neurotoxins and fillers. And most people are pretty familiar with those. A lot of people are most familiar or think of neurotoxins as being synonymous with Botox. So what those are substances that are going to prevent contractility of the muscles, especially we see those with expression lines. So those are called dynamic rhytides. So anytime you move those muscles, and I can't move very well because I think I still have some left over from our last employee Botox. So those different ones, Dysport, Xeomin, Botox, which most people are familiar with, and there's a newer one called Jeuveau. We don't offer that at our clinic, Jeuveau, but the other three we do. And so it's often difficult for patients to decide which one to do. And honestly, it really doesn't matter. Clinically, the differences are negligible. Some people may personally like one more than the other, or it may seem to work a little bit better for them than the other. But studies don't show a whole lot of difference. Usually what it comes down to is which rewards program you already have, and if you're going to bundle it with any other products or fillers. So really that's kind of how we end up deciding. Prices are pretty similar for those. As far as fillers go, most of the fillers that I use are hyaluronic acid fillers. And so those are reversible fillers or dissolvable fillers. And they can last anywhere from 1 year to 2 years for the most part, depending on what area you're treating and which filler you're doing. Most common places that we do that would be the middle part of the face, and the lips are really the two most common places. Sometimes patients will come in and point to their nasolabial lines or their marionette lines, and they think, you know, hey, this is what I'm noticing, but really maybe the volume loss is coming from the middle part of the face. As we age, we lose those apples of our cheeks. So when you kind of push on that, it accentuates those lines so you can kind of see. So we like to correct the underlying problem. And so generally that's going to be the apples of the cheeks. We can then go ahead and add filler to the areas that the patient is concerned about as well. But we don't want to start with that because that's sometimes people will kind of end up looking, I describe it like an ape almost, if you do that. So this is kind of like a curtain rod. That's how I like to describe it to patients. Probably all my patients have heard that analogy. Just like a curtain rod that kind of holds up everything else. So the other area that gets injected a lot is the lips. And some patients want plump lips, and that's totally fine and cool. And I see a lot of women in their 60s or 70s that come in more with complaints of my lipstick runs when I put it on, or I've got, some little, what we call smoker's lines around the lips. I see that quite a bit in people who drink out of a straw a lot too, not just smokers or people who whistle. So that can be easily corrected with filler too. And you don't have to worry about necessarily having duck lips. I mean, we can definitely do that in a nice, very cosmetically pleasing way that doesn't look obvious to others. You will have a little bit of swelling, usually for a couple of days afterwards. So you might want to go into hiding. But once that's all worn off, most people can't even tell if you just do it minimally, and that corrects those lines as well. We can do what's called a lip flip too, which is actually adding neurotoxin to the filler, and that kind of pulls the lip up a little bit and helps with those lines as well. Another question that gets asked a lot is under eye complaints, and that really is going to depend on what's causing the problem. So it could be that you have increased vasculature where you can kind of see the bluish veins underneath, or congestion. And that can be from allergies, so maybe we need to work on treating your allergies. Or it could just be that the skin is, quite thin, like tissue paper, so you can really see that bluish color, and that gives you those dark circles. So we can thicken the skin up with retinols and peptides, things like that we have in the office. We can talk to you more about those individually as well. Sometimes I'll even see a patient that comes in for just swelling or edema, and that could be because of, maybe even ill-fitting glasses that's pushing on the lymph channel there. Or I've had some patients with some fat pads that I send them to a plastic surgeon, and they just kind of do a little fat transfer, and that actually has a really pretty result as well. So one of my favorite products for under the eyes is AGE interrupter, AGE interrupter from SkinCeuticals. So we have lots of different things we can recommend. It just really depends on what's causing the concern. It's not a one size fits all. Another problem is patients come in wanting thicker and longer eyelashes. My go-to for that would be Latisse. Latisse is pretty awesome. In a small subset of patients, it will cause some irritation or a little bit of darkening of the skin of the eyelid. And light-eyed people, I do warn them just to watch for any increased brown pigment in the eyes. But it's tolerated well in most people and has really good results. Next would be wrinkles, just overall kind of complaining of wrinkles. And so with that, it really depends on the severity. If it's just mild, definitely you want to do preventative measures with sunscreen. If it is more mild to moderate, I love microneedling. Microneedling, you might have to do about 3 treatments. You don't have a lot of downtime with it, a couple days, and it's tolerated really well. The problem is just that you don't see results usually for about 6 months afterwards. For more severe wrinkling, most of the clinics offer a fractionated laser that I think Dr. Zelickson might talk a little bit more about that as well. That usually you just need 1 treatment. It is a little more pricey, and there's going to be some more downtime with that. And then also on the screen, I had created this before I saw the other speakers, what they were going to present. So it's just kind of overall skincare routine. And I think Dr. Zelickson has a good presentation on that. So I'm going to kind of leave it at that. The only thing I'm going to add to it is I do see a lot of patients coming in spending money on things like collagen creams, which, collagen's not going to be absorbed in that large of a molecule. So just make sure you do talk to your providers about, or your esthetician or whoever it is that you see about your skincare regimen, just to make sure you're not wasting money on something that's not scientifically proven. Let's see. The next thing I think, especially in the last couple of years, I've been seeing a lot of is patients interested in cool sculpting. Cool sculpting is awesome because it permanently reduces fat in any given area that you treat by about 20% with each treatment. So some patients may just want 1 treatment. Some patients may want to get that additive effect of 40% or 60% reduction of fat in an area. It is great for sculpting. It's not good for fat loss or weight loss. I should say weight loss. It's good for fat loss. So just just make sure, if it's a weight loss problem, you wouldn't be a good candidate. But if it's just a kind of a sculpting issue or a problem area, cool sculpting is really, really pretty amazing. It doesn't tighten the skin. So Tighten Laser is what we offer in Illinois. I know, I think Minnesota maybe has old therapy. And again, Dr. Zelickson probably will talk to you more about that. But those can help tighten the skin. For hair removal, it really is going to come down to your skin tone, the pigment of the hair, hormonal issues, things like that. So we can talk to you about what's best for you, but it could range anywhere from a prescription cream, could be some prescription pills, especially if you have PCOS or some sort of hormonal issue. And then we do use lasers and infrared as well. I think this is my last slide. So sunscreen, I think Dr. Nemer went over that for you. Just a couple of things that I do usually tell my patients. Number one is it's safe. The ones that are not recommended are not legally available in the United States. So I know I have a lot of patients with concerns on safety after some recent studies a couple years ago. Chemical versus mineral. Patients usually ask, well, do I put that on before makeup, after makeup, etc.? Usually chemical, think of it like a sponge. It's going to absorb the sun. So you're going to want to put that on first before you put anything else on. And then mineral, well, not necessarily before anything else, but before your makeup. And mineral, you're going to want to put on after your makeup. That's more like a barrier. That's going to go on after. Also, a lot of patients make the common error in just using an SPF. It's easier, it's in their makeup a lot of times, and so they just use an SPF. That's just going to really keep you from burning. That's not going to protect you from those UVA rays, which are those long rays that Dr. Nemer was talking about going through the windows and things like that. So those are the rays that are going to cause your brown spots and your wrinkles and those kinds of things. So make sure you're wearing a broad spectrum sunscreen, a UVA sunscreen as well. Lastly, it's just the slide on kind of problem-specific complaints that I see pretty commonly. Again, I think Dr. Zelickson has a couple good slides on that, so I'm not going to spend a lot of time on it. My only addition would be on brown spots. Make sure you are seeing your healthcare provider once a year. I usually recommend to most of my patients once a year. And it does, like Dr. Nemer said, depend on your history. But sometimes I've seen patients wasting money on using a lightening cream on seborrheic keratoses. They're kind of macular and they look like a freckle. Sometimes they're more obvious, but it's not going to work and you're going to waste your money. And then also I've seen lentigo malignant melanomas, which have been lasered. And that's not good either. We want to make sure that we're lasering the appropriate brown spots. So I think I got time for some questions if anybody has questions. Okay, I think mine start here. They're kind of all together with Dr. Nemer's, but what's the best solution for dark spots on the face, specifically under the eyes? I guess it's going to depend on if that's more allergic shiners, like kind of the dark circles like we talked about, or if it's more hyperpigmentation from the sun. So that would be great. We do consults, so might be a good idea to either email a picture if your provider allows that. Otherwise, you could do a consult. It really just is going to depend on what's causing the dark circles or the dark spots. Does tretinoin products help reduce the risk of skin cancer? Yes, they reduce the risk of actinic keratoses, which are precursors like Dr. Nemer spoke about, those vitamin A derivatives. So that's definitely going to give you the benefit of helping prevent precancers, but also anti-wrinkle and all that other good stuff. What causes double eye bags? Sounds like kind of like a redundant skin issue. It's really hard to say without seeing you though. Might be a plastic surgery issue. Lentigo maligna. lentigo malignant is usually going to be in women in their 60s or 70s. It's a larger looking freckle, just a brown spot, but usually it's going to have some variable pigmentation. It's not necessarily all one color, but they kind of just look like a big freckle. If I want my lips done, how long does it last? The most recent one lasts about a year. KISS, Kysse. Some of the other ones only last about 9 months. So that one lasts about a year. How long does needling last? So microneedling is going to result in permanent increase in collagen. However, a lot of patients do kind of do some maintenance treatment. So they'll usually do 3 in a row over the course of about 3 to 6 months. And then after that, it's not a bad idea to do one every year just to increase collagen as you age. Best treatment to tighten the neck. In our clinic, Tighten, I think some people would argue oil therapy is better, but it really just depends. And some cases aren't laserable. Some cases would have to see a surgeon.
I'm going to be talking about acne and rosacea. I get a lot of questions from my patients about what ingredients and what products they should be looking for to treat these conditions at home. I also tend to see a lot of patients that come in on my scheduled for acne, but then in person they actually have rosacea and vice versa. So we're going to talk about the differences between these two conditions, as well as some key ingredients you should look for in your skincare products. So give me a second here to share my screen with you all. And we will get started. So acne essentially is an inflammatory disorder that starts actually at the level of the hair follicle, so the pores on our face. It's extremely common, and unfortunately it's not just limited to teenagers. I see patients all the way from adolescence into adulthood with this disorder. And as a dermatologist, when I'm examining your skin, what I'm trying to do is determine which acne types you have, because that's going to dictate really which types of treatment I recommend for you. So first I'll start with non-inflammatory acne. Another name for this is comedonal acne, so that's the whiteheads and blackheads on the face. This type of acne results just from buildup of dead skin and oil in our pores. It's a precursor lesion to inflammatory acne. And inflammatory acne results when those contents in the pore bust open underneath the skin, and then you get recruitment of bacteria. So that's the pink bumps, the pus bumps, nodules and cysts. And this is the type of acne that can leave behind scarring and discoloration. And then in bold, I included hormonal acne. This is really kind of a special type of inflammatory acne that I see in my post-adolescent females, and it has a very characteristic lower face, jawline, chin, can even extend onto the neck type distribution. And in reality, most of my acne patients that are female after age 18 do have some hormonal component to their acne. So this is just a nice pictorial review, again, to break down those types of acne. Over here, we've got our comedones, we've got our whiteheads and our blackheads, we've got our inflammatory acne, and then we've got our hormonal acne with that nice classic jawline distribution. So in talking about acne treatment, really the biggest takeaway is that consistency is key. It takes at least 6, if not 8 weeks to start seeing results from the ingredients you're using, and really upwards of 12 weeks. I like my patients to give their treatment regimen a solid 3-month run before we decide if we need to try something else. Some key active ingredients you can look for that don't require a prescription include benzoyl peroxide. It's a really nice anti-inflammatory, antimicrobial ingredient, really nice for that inflammatory acne. There's salicylic acid, which is a beta hydroxy acid, or BHA for short is the other name for it. And salicylic acid really can penetrate deep down into the pores to kind of clean out that oil and dead skin. So it's a really nice ingredient if you are someone that deals with a lot of comedones, the whiteheads and the blackheads. There's also AHAs, or alpha hydroxy acids. That's a separate family of acids that includes glycolic acid, lactic acid. Those acids don't penetrate down into the pores quite as deeply as salicylic acid does. They still can help kind of exfoliate the skin and clean out those pores. They also tend to have a nice brightening effect. For people who find salicylic acid too dry, AHAs can be a nice alternative. There's also azelaic acid, which is a separate family of acids. Azelaic acid does provide some gentle exfoliation as well as some anti-inflammatory and antioxidant properties, and it plays well with our AHA and BHAs. And then the last ingredient I want to highlight is retinol. So retinol is a vitamin A derivative that helps regulate skin turnover so that your pores don't have a chance to get clogged up and form acne bumps. It also boosts collagen production under the skin. So long-term use can lead to minimization of fine lines and wrinkles. So it's a kind of a powerhouse anti-aging ingredient as well. Some recommended non-prescription products that I think are really nice for my acne patients. So these are some of my favorites from our clinics that I like to highlight. The first is this Skin Medica Aha Baha Exfoliating Cleanser. It has chemical exfoliants in it because of the AHA and BHA, but it also has a really nice fine particle in it to kind of give you some physical exfoliation. So it has a really nice tingling sensation when you apply it. Really good for acne prone skin, can also really kind of brighten and even skin tone. The next product I want to talk about is the Is Clinical Active Serum. So this is a really unique product for acne prone skin. It's really kind of one of its kind in the market. It's a blend of special botanical extracts that are going to promote exfoliation and reduce inflammation in the skin. If you have acne prone skin, this is a really nice serum to apply for morning use. The next product I want to highlight includes benzoyl peroxide, which, as I said, this is a great ingredient for inflammatory acne because it is antibacterial, really helps take down inflammation quickly. This product is the MD Complete line from the MD Complete line. It's the breakout treatment. It's got 4.5% benzoyl peroxide, so it really tends to be well tolerated on the skin. It's compounded with a lot of other nice ingredients to help reduce the irritation that benzoyl peroxide can sometimes cause. You can get products over the counter with up to 10% benzoyl peroxide in it. And the higher the concentration, the more irritating it tends to be. So this is a really, in general, well-tolerated product. You can either use it to kind of treat individual spots on the face, which I always say kind of a really thin layer, twice a day for individual spots. But if you're someone with oilier skin who tolerates this ingredient without irritation, you can definitely use a thin layer to the entire face because it will prevent new acne spots from forming. The last ingredient I want to talk about is retinol. As I said, this is a vitamin A derivative that has both anti-acne and anti-aging properties. This product is from Revision. It's the DEJ Night Cream for the face. It's got retinol in it, which can be an irritating ingredient, but in general, this is a really elegant product that's compounded with moisturizers and other things, so it tends to be very gentle, well tolerated, good for acne and anti-aging. I'm going to move on to talking about rosacea, because like I said, a lot of my patients who think they have acne come in and actually have rosacea. So rosacea does tend to be a more chronic inflammatory skin disorder than acne does. We think it's kind of a hypersensitivity really to stimuli that are usually non-noxious. Onset's typically a little later than acne, so 4th decade of life, but I do sometimes see it in patients in their 20s, and this can extend late into life. There's 4 major types of rosacea. The first is erythematotelangiectatic or vascular rosacea. This is really just characterized by facial redness, facial flushing. The next type is papulopustular or inflammatory rosacea. This is when you do tend to start getting some acne type lesions. It varies from acne though, and that the lesions tend to be concentrated more in the central face, and the lesions are also a lot smaller. They're very kind of small, fine pink bumps and micro whiteheads. You may also kind of get some kind of dry red, almost eczema-like change underlying these inflammatory bumps. The third type is Feminist Rosacea. This is rarer, but tends to affect men more commonly, even though rosacea is more common in women. And this is characterized by some bumpy, irregular thickening of the nose. And then the last type I want to mention is Ocular Rosacea. That's characterized by dry, red, burning eyes. And it is possible to have rosacea of the eyes only without any skin findings. So here's kind of just two nice pictures to illustrate the types of rosacea I see most commonly. So you've got the vascular type, which, as I said, is really just characterized by facial redness more so without a ton of inflammatory lesions. Laser can be a really nice treatment for that one. And then you've got the papulopustular variant on the right. As you can see, a lot of kind of small pink bumps clustered together in the central face with a few white heads. So when we talk about rosacea treatment, really the most important thing that we're going for is kind of soothing the skin, reducing inflammation. So you want to look for products that are a lot more gentle than what we typically reach for to treat acne. So you want to avoid anything that causes excess irritation. And we try to counsel patients on trigger avoidance as well, which common triggers for rosacea include hot food and drinks, alcohol, spicy food, and UV light. UV light can really kind of keep rosacea active. So I counsel all my patients on the importance of really strict sun protection. As part of their treatment recommendations, I like them to use a broad spectrum SPF of at least 30 or higher every single day, rain or shine, no matter what. And I prefer the physical sunscreens, so titanium dioxide or zinc oxide. Azelaic acid is an ingredient I mentioned for acne that can actually has nice benefit for rosacea as well. And then there's certain products and moisturizers that can actually be really helpful for rosacea. So ceramides, it's a lipid that kind of helps to repair the skin barrier. And then humectants are certain classes of chemicals that actually attract water into the skin and help your skin retain hydration. So some nice products that we sell in our clinics that I like for rosacea. Number one is the SkinCeuticals Gentle Cleanser. This is a cream-based cleanser, and cream-based cleansers can be really nice for rosacea because they're not going to leave your skin with that squeaky clean feeling. You don't want to strip away all those oils. So this is going to be a really nice, gentle option that is not going to dry your skin out and cause excess irritation. A nice serum for my rosacea prone patients is this Clinical Pro Heal Advanced Serum. This has vitamin C, which is an antioxidant. So what antioxidants do is they help protect the skin against environmental stressors, which I mentioned can be a trigger for rosacea. This combines the vitamin C, which has some nice skin brightening properties as well, with olive leaf extract, which is really going to help calm inflammation in the skin. So another kind of nice botanical product from Clinical that is really nice and soothing for my rosacea patients. Like Dr. Nemer, and Carrie, I have to put in a plug for sunscreen. I really love this Elta MD. This is what I use myself every day. And in particular for my acne and rosacea prone patients, I really like this UV Clear. It's an SPF 46. It comes tinted or non-tinted. If you are someone that struggles with melasma or other types of hyperpigmentation, the tinted may be a better option for you because that will protect you against blue light, whereas this won't. But it's broad spectrum, SPF 46, and has 9.5% zinc oxide. So this is a really, really great sunscreen for acne rosacea prone skin. And then the last product I want to talk about is this Neocutis Bio Serum Firm. This is another favorite of mine that I use every day. So this will not treat your rosacea in and of itself, but I included it because a lot of my rosacea patients don't tolerate some of the anti-aging ingredients that other patients can. And in particular, retinoids and retinol can be irritating to some rosacea patients. So in that case, patients are asking me, well, what can I do instead? And this is a serum, so there's no retinol in it, but it has growth factors and peptides, and that's going to help boost collagen production underneath the skin to minimize appearance of fine lines and wrinkles over time. This product has just like a lovely velvety feel. It's really, really nice. So when is it time to come in and see one of us about your acne or rosacea? So I always say if you're using a good mix of kind of some of the key ingredients I talked about and your conditions continuing to flare, come in because you may be reaching for the wrong things, or it may be time to up the ante on your treatment. If your breakouts are starting to leave behind discoloration or scarring, it's important to kind of get ahead of that. If your breakouts have any psychosocial implications, time to come in. And then pregnancy and breastfeeding is a very kind of special time where a lot of ingredients we like for acne in particular are totally off limits. So if you're in that stage of life, touching base with a healthcare professional is really, really important to make sure that you are using the absolute safest skincare regimen for you. And then of course, anytime, we're happy to walk through what you're using, what your routine consists of at home, and then we can decide together if adding prescription strength treatments is indicated for you. So I really appreciate all of your time and attention, and I'm happy to take questions at this time. Okay. So the first one I see is, are there things you shouldn't do with rosacea? Clarisonic use, exfoliants, retinol treatment, etc. So in general, I advise against those types of treatments that tend to be a little more drying and irritating for my rosacea patients. Certainly, I think chemical exfoliation is one that can get the skin a little revved up, but a little bit of gentle chemical exfoliation, maybe with something like a glycolic acid or lactic acid, may be tolerated. It depends on how severe your rosacea is, and checking in with your dermatologist, they can better advise you as far as what you should use and what you shouldn't. So next, I think that one was for Carrie. So this is a great question. Since wearing face masks, I'm breaking out on my lower face. I'm in my 60s. What should I be using to prevent or treat breakouts? So this is a huge problem that we're seeing across COVID. A lot of times the breakouts are actually coming from excess breakdown of the skin barrier. So your skin barrier isn't well protected. So I always say put on a really nice bland moisturizer, something with ceramides in it before you put on your mask. I really like the Skin Medica TNS ceramide cream, or even CeraVe. I mean, the Cera part in it is for ceramides. And then the Is Clinical Active Serum, actually, a lot of my patients have found that really helpful for their acne. So you kind of get home, wipe gently with just kind of nice warm water underneath your mask, and then put that on. How do you treat ocular rosacea? Ocular rosacea is really best treated by an oral antibiotic called doxycycline. If you're concerned that you have ocular rosacea, I definitely recommend coming in for a visit so we can discuss that prescription treatment. Again, I have rosacea, and wearing my mask seems to break out my chin and nose area quite a bit. What can I use? Again, I say a nice, gentle, bland moisturizer. And azelaic acid also tends to be a helpful ingredient for this. Azelaic acid, there is a prescription strength cream you can get, but it's also an ingredient that's available in a few over-the-counter products. The Ordinary makes a nice 10% azelaic acid. Paula's Choice makes an azelaic acid, and that can be kind of a nice ingredient for acne, patients. Is fungal acne a thing? My friend found a whole Reddit. We could go down the Reddit rabbit hole. So I don't really, there is yeast that can get into hair follicles and cause a folliculitis. I typically see that more on the trunk, but fungal acne on the face is not really a thing. It's not really acne on the face if fungus is causing it. So what do I think of Mirvaso? So that's a topical medication you can apply to the skin to reduce flushing. And what about laser for the redness? Does omeprazole help? So I don't find much benefit from omeprazole. Mirvaso can be nice for some patients. The trouble is it's expensive, usually not covered well by insurance, and sometimes you can get some rebound flushing. I really think laser treatment is kind of a much better investment in your skin for durable relief of the redness.
That set up. Here we go. And as you mentioned, I'm going to talk today about skincare consults that we do for primarily cosmetic treatments, and really how we use this to design sort of a personalized skincare program for each person. So let's see here if I can get that going. There we go. So when people come in and are questioning about, cosmetic care, some people come in for a specific treatment or laser that they've heard about, or some people have a specific issue that bothers them. And a lot of people come in and say, look, I feel younger, and when I look in the mirror, I just don't feel like I should look, or I don't look like I feel, and I want to just feel more rested. So there's a lot of things that people come in with, but what we like to do is kind of go through what happens with aging, kind of discuss the things that occur in our skin and outline the things that we can do about that. So the way that what we look at this is kind of divided into sort of 4 things that happen. And as you can see from this sort of split face, as we age, multiple things happen to our skin and to our body. And looking at the face, the first thing that we try to address is what I call the canvas of the skin, or the surface of the skin. And with that, we can see irregular coloration, such as brown spots, red spots, and fine lines and wrinkles. And when we look at that, there's, as Karilyn pointed out earlier, there's multiple things that we can do to kind of address those types of issues. First thing I think that's most important, as you know, as practitioners and dermatologists, we want to rule out if there's any other medical issues. You heard about some precancerous spots that we can see, some acne or rosacea, and we try to deal with that obviously first. And once we have, then we kind of look at the skincare. What can we put on the skin? What's the easiest thing that we can do to kind of address some of these problems? And there's preventative skincare, things that we do to prevent these spots from getting worse or occurring. And then restorative treatments, and we'll talk a little bit about that, but creams that we can put on that really can make a difference. And then the third thing, we look at other light sources or energy-based sources, such as lasers, intense pulse lights, broadband light sources, and other types of things that basically can address the brown spots, red spots, and fine lines and wrinkles. And we'll kind of go over those treatments in a bit. The next thing that we look at is sort of the texture of the skin, sort of the little deeper lines, the folds and scars of the skin. And as we age, we see that the lines get deeper, the folds get a little bit deeper, scars that may have had, even acne scars, actually look a little bit worse as we get older, even though we may not be getting more acne. Sort of the padding in the dermis, or the deeper portion of the skin, the collagen, elastic tissue, and the sugars, the hyaluronic acid that's normally in our skin, we start to lose. And so with these, we talk about a lot of different things that we can do for the texture. If it's fine texture, certainly just skincare, topical products that we can use, peels that strip off or remove the surface of the skin. Carrie had mentioned neuromodulators, the Botox, the Xeomin, the Dysport, that works for dynamic lines and wrinkles. And then fillers, such as the ones that we use as well, is the hyaluronic acid-based fillers. This is a sugar that's mostly found in our skin. The ones that we use are synthesized, that we can inject and repopulate the skin and the scars. And then obviously lasers. And what we do with lasers primarily to improve textures, we're using these to create wounds in the skin and stimulate a wound healing response so that we get new elastic tissue and collagen to form, and that smooths out the skin. The interesting thing about this is we use them for all different types of scars, whether they're acne scars, lines from sun damage, burn scars, surgical scars. And what's always intriguing to me is when we create these very controlled injuries into the skin and we get this wound healing response, is we see that sometimes thicker scars will soften up and get smoother. We see depressed scars that can fill up and get more even. So it kind of resets the skin and smooths out those surface irregularities. And then the third thing that we look at is, as we age, is we get volume loss, or if we lose a lot of weight, we do a lot of exercise, and we lose a lot of volume. And when we do that, we don't really think about this a lot, but we have fat pads in the skin that give us, you know, a nice sort of rounded face. And when we start to age, we lose that fat pad, and we can see we lose volume in the upper cheek, and that allows the skin to sag and increase the nasolabial fold here, and we get sagging or jowls here. And a lot of this can be corrected by repopulating that volume. And again, we use these fillers, these hyaluronic acid-based fillers, to repopulate that. And that gives us a nice cheek contour and elevates this sort of fold or lax skin. The fillers, as Carrie did a great job talking about, they can last anywhere from 6 months to 2 years. And there can be a little bit of downtime with that, and you know, some risk with that. And then lacks the sort of loss of elasticity and skin sagging, as we talked about. We can use fillers to address that. And then there's some non-invasive treatments, the cell therapy or the Titan. What these devices do is they basically create an injury deep into the skin stimulate a wound healing response underneath the skin to cause some tightening of the skin. The results of those are modest. We can use them on the face and the neck. Most people that we do it to, they come back and the results are seen in 4 to 6 months, and they say, yeah, my skin feels a little tighter. And we take pictures and you can see a little improvement, but it's not real dramatic. And so if people have a lot of elasticity and volume loss and lack skin, like this picture on the right side or the patient's left side, really you need surgery to address that. And so we can use that as a method to help things as well. And so once we kind of go through with each person and kind of figure out, what bothers them and what kind of things we can address, then we put together a treatment pyramid, and we kind of look at these types of things and put together a plan that we're not only not going to do everything on day 1 or the first week, but something that can make a good progress over time. I mean, we're here for the long term. We want to have people that get results that they're happy with and then maintain those results. And so the first thing that we try to address is really, as everybody on this tonight has talked about, is sun protection. And that's really preventative skincare. So before anybody really starts any more invasive or more aggressive treatments, we really want to make sure they're doing the right thing to protect their skin, and that's sun protection. So not only getting, as you heard multiple times, a good sunscreen, which is at least a 30 SPF or sun protection factor, that's broad spectrum, but actually one that you really like to put on, that feels good when you put it on, because if you don't like it, you're not going to put it on. But also, changing your activity, doing more active things outside earlier in the morning, later in the day, wearing broad brim hats and those kind of things. So that's, critical, that as dermatologists, we always, try to stress. And then we look at the next sort of easiest thing to do is what I call restorative skincare. And these are topical products that we can put on, and they actually make a big difference. And in doing them long term, you can see a very significant improvement. I've been in practice long enough, so I've seen people that have used good skincare for decades, and they get really dramatic results. You can see a big difference if you do things consistently. We kind of talk about it like going to the gym. You want to get in shape. You don't just go 1 day a year and you get in shape and you're good for the rest of the year. But if you go, regularly, a couple times a week and do a little bit, it makes a big difference. And that's the same thing with skincare. So we have products that help with improved tone and texture, such as the retinols or retinoids, skin lighteners that help with pigmentations. Some other products that have antioxidants and peptides in them that also help with skin tone and texture. And so we kind of put together a plan for the person based on that. That should be a long-term, easy plan. Now, in our practice, we see a variety of people. There are still, with people that are pretty motivated, very few people that can do a 7 to 10 step regime of topical skincare. It's very hard to keep that up. So we try to make it very easy, a 2 or 3 step program that people can do on a daily basis. And then we look at restorative treatments. So here we start looking at skin pens, peels, lasers, ultrasound, and other energy-based modalities to address those conditions that we talked about, the pigmentation, the redness, the fine lines and wrinkles, the scars. And we put together a plan that makes sense. And part of this is explaining what kind of results we can get, what the downtime is, and what the risks are that we go through when we do these treatments, because there's always risks. For specific lines of muscular expression, as Karilyn mentioned, the glabellar lines, the crow's feet around the eyes, we use neuromodulators. These work phenomenal. It's the most common cosmetic procedure performed in the world, and very, very safe. It's rare that we have complications, but not impossible. And so we go through that type of treatment. And then certainly we talked about the fillers. Again, probably the second most common procedure that's done to recreate that volume and lift. And then there are some people where we can do some of these or several of these, but they're not going to do the job. And so they really need some type of surgical intervention. And we have colleagues that specialize in eyelid surgery or facelift surgery that we can refer to. So just to kind of highlight some of those things, this is 2 twins. It's from a famous twin study that was done over a period of years. And these twins lived in different geographies of the country. And you can see the woman on our right side obviously had a lot of sun exposure, and the woman on the left had very little. And this is without any intervention. You can see the significant changes that we see just with sun exposure, the fine lines and wrinkles, the pigmentation, the laxity of the skin, this type of loss of tone. So a lot of changes just from sun protection. And that's, again, why we kind of harp on that so much, because it makes a big difference. And this is from another study from a friend of mine, Dr. Tangeti, who was studying the use of a retinoid. This is a woman that had no laser or peels or skin pen intervention. All she was using was a topical retinoid. And you can see the significant improvement in the tone of her skin, improvement in the fine lines and in the pigmentation. And so oftentimes, if people haven't been on a good skincare program and they come in and want to have laser, we'll say, well, look, let's start with a skincare program, give it 6 to 8 weeks, see how you're doing. And some people come back and they're seeing improvement and they decide they're going to hold off on the laser treatment. I love doing laser treatments, but sometimes it's not something that we just jump to. And there's a lot of things that we can do with using a consistently good skincare program, as you can see here. This is a woman with redness, and she, you could say she has erythrogenic rosacea, but the treatment is the same. And this was treated with a pulse dye laser. This is her on the left before treatment. The nice thing about these lasers now is this immediately after. People get a little more redness and swelling for a couple hours to a couple days, rarely longer. And then after 2 treatments, you can see the significant improvement. And so we use a couple different lasers to treat this. It works excellent. Probably the most common thing that we do. There was a question about Mirvaso, and there's another, Rofade. These are topical creams that vasoconstrict the vessels. So they're used as on a daily basis to constrict the vessels. And I agree with Dr. Sellinger. Oftentimes, it can look a little ghostly sometimes, and you can get some rebound flares. And so generally, I'm not a huge fan of those because I know how well that the lasers work. We can use intense pulse lights or broadband lights. These are not lasers, but they're light sources that do address redness. It's basically what a laser is a device that has a specific wavelength that targets a very specific target, like the redness in the blood vessels. An IPL or BBL is a flash lamp, and we put filters in that to get a series of wavelengths of light, a lot of light. Some of it may address the redness. So it's a good device. I kind of think of it as a jack of all trades, master of none, whereas a laser is one that is very specific for a particular condition. And this is a woman that has some photo aging, the fine lines and texture of her skin. And this is after an ablative fractional laser. And what this laser does is it pokes little holes in the skin, like you have your lawn aerated, creates a wound, and then that wound heals up. And with that, you get improvement in the texture. With this one, there is a bit of a downtime with it. There's milder ones that have less downtime. Our goal with these types of lasers is to get 30 to 50% improvement, in the fine lines or texture, and that can take anywhere from 1 to 3 treatments with that. And then lastly, as we talked a lot about fillers, this is a picture of somebody kind of before the fillers. You can see the accentuation of her jowl and her nasal fold, and afterwards, it's a natural look. It softens this up and kind of helps with the fold with that. So many times when we put together a program, we use multiple modalities. It's not just one thing for one person. And you can see we can have dramatic results from a cosmetic standpoint using these and depending on what each person wants and is looking for. So with that, that's our treatment pyramid once more. And I think I'll conclude and have probably time for a few questions if there are any. Let's see. Okay, here's I got one here. Does laser help milia? Milia are small little superficial cysts, and generally the lasers are not needed. You could use a laser to treat a milia, but there's much easier and less costly ways to take care of those. Let's see. Here's one. When I think of skincare, I really only want to use non-toxic products. Oops, let's see. Does your clinic carry such of those products? Yes, we get those questions a lot, and we do, we hope that all of our products are non-toxic, and it kind of depends what each person's definition of that is. A lot of people want botanicals. Poison ivy is a botanical, and that can be toxic to somebody. But basically, the products that we have, we try to get products that are more naturally oriented, that are non-animal tested, and basically kind of fit in that realm. It's interesting. I worked with Aveda for a long time with the founder Horst, and obviously he was one of the leaders into that foray of natural and organic products, and we definitely are pushing in that direction. But it was interesting, even when working with him for so many years, there are certain active ingredients that are just really good, and it's hard to get a replacement that's sort of a natural organic ingredient that does the same thing. One example is hydroquinone. Hydroquinone is a lightening agent that is really the best topical lightening agent that we have, but it does have potential toxicity, and it's not something that we use for long term. There are many other types of lightening ingredients that we use, but they just don't work as good as the hydroquinone. But for certain people that don't want that, we have alternatives. So that's a great question, and we wrestle with that all the time. Let's see, who can I schedule an appointment to come in with my treatment plan, and what is it? So generally in our clinic, it's just a consultation, a cosmetic consultation, and then you meet with us and we kind of go through that program with you. This is a great question. What's the best treatment for extra neck skin? Really the best treatment to get results is a lower facelift. We've worked a lot with Ulthera, with Titan, and even ablative lasers that we've used on the neck, and you can get maybe a little bit of tightening, but for most people, when they talk about that, if you take your fingers and kind of move them up your jawline, people move that skin up probably 1 to 2 inches, and there's no way a non-invasive device is going to get that kind of improvement. Now, there are a couple companies, 2 companies that are looking at ways that are minimally invasive that would potentially address that. There's a company called Recross Medica, which is actually was founded by the founder of Thermage, if you remember that sort of tightening device. And what it does is, it's pretty unique, is it takes small little biopsies or tiny little biopsies of skin, kind of like the laser does, but then they bandage it up and they remove a bunch of little spots under the neck. And then when it heals up, they can get some tightening and some improvement. And so that's, they're in their clinical studies now. So there may be something that we can do that's better than these non-invasive treatments. It's got a little more downtime, but certainly would be less aggressive than a facelift. So keep tuned to that. Neck, yeah, a lot of questions about neck. So we do fractionated laser treatments. We do the Titan, we do Ulthera on the necks, and we get some improvement, skincare, but it kind of depends on, what we're addressing there. Here's a question about Ultherapy. We talked about that. That's basically, it's an ultrasound device that basically focuses the energy of the ultrasound into the deeper layers of the skin, and it creates small little zones of injury, lays out a bunch of them deeper into the skin, and when that heals up, you get some tightening and improvement. It is the only device that is FDA cleared for lower face tightening. It also has approval for brow lifting, and we kind of use it for that. It's about a 45-minute procedure. It's a bit uncomfortable. You have some redness and swelling afterwards for a couple days to a week or so, rarely get some bruising. And then we see the results sort of, 3, 4, or 5 months later, where you slowly get some improvement and some tightening in the skin. What was used? Yeah, that woman on the last slide, she had a facelift. So she had a facelift plus a skin resurfacing procedure. So that neck improvement you saw on the jawline was primarily due to the facelift. What laser performed the most? Is there a laser overall for good? Yeah, so that's a great question. And from a volume standpoint, in Minnesota, we probably do mostly treatment for redness. So I use 2 lasers for that, a KTP and a pulse dye, but there's a lot of lasers that we can use for that. And probably for skin tone and texture, we either use an ablative fractionated resurfacing, or we have really a nice treatment that's a combination of a laser that targets pigment and then one that does a superficial resurfacing on the skin. So there's, it's pretty easy to go through, and you have a sunburn reaction for about a week. It's called the Q-Switch Alex dual treatment. It's one of the Fraxel devices, and that works quite well. What is your opinion, efficacy of plant-based retinoids? Yeah, you know, we've played with those a lot. I think they're not as, a lot of retinoids aren't very stable, number one, and I think the best ones are, you know, from an efficacy standpoint, are, you know, the synthetic ones that we're using. Let's see, do tools like NuFace do anything beneficial? You know, that's a great question. I think they do. I think they have to be used correctly, and it's kind of like skincare. What some of these devices do is they create a little bit of a wound. I think the NuFace may have a couple different modalities, but we've done a lot of work early on in my career. We were doing a lot of work looking at how the skin healed, and we were doing skin or tape stripping on the skin. So we would put cellophane tape, you know, Scotch tape on the skin and kind of peel it off, and it would just peel off a very superficial layer of what we call the stratum corneum, or the dead layer of the skin. And we did this over time, and then took biopsies and kind of looked to see what would happen. And we were kind of measuring how quick the skin turned over. And it was really interesting because what we noticed is that when we did it on sun-damaged skin, it actually would normalize or thicken the epidermis, the top layer of skin, where usually that's very thin. So it had a regulatory effect to say, hey, look at, you know, we're being a little injured, we need to step things up, and it thickened up the top of the skin. But another thing that we found, which was really interesting, is that when we stained for collagen fibers in the skin, it actually got some new collagen that was developed in the very superficial dermis. So we call it the Three Stooges effect. You know, we would damage the stratum corneum, that would create a response in the epidermis, which would then create a response in the dermis. So some of these things that may seem kind of trivial, if you do it consistently and, you know, not too aggressive about it, you can get some improvement. So it's kind of interesting on that. Let's see. Thoughts on skin pen? Again, that's kind of another way to injure the skin. What we try to do with a lot of these lasers is to create a wound. And what we want to do is create the biggest wound we can to stimulate the biggest wound healing response that will give us the most improvement, or the most collagen elastic tissue. But we don't want to make it too big that it leads to a scar. So it's kind of a balance of creating a big enough wound to get the most response, and one that heals up quick and doesn't give us a scar. So the way I kind of look at this is with a skin pen, we're taking basically a little pin and just poking it into the skin multiple times. There's many different types of pens out there that go, you know, deeper than others, and you can adjust them a little bit. And what that can do is you can, you know, create a minimal injury. And as Carrie mentioned, you can do a series of those, and over time you can see some improvement. The difference between that and, say, a laser, we have non-fractionated, we have non-ablative fractionated lasers and ablative ones. The non-ablative ones basically create a thermal zone of heat. So it creates a column of heat in the tissue. It doesn't remove anything, but it heats up a volume of tissue. And that's a bigger wound than just a pinprick. So I think we get a little bit more wound healing response and a little better results. And then we have the ablative fractionated treatments that actually the laser bores a hole and vaporizes a column of tissue, creates heat around there. So you're not only removing skin, but you're creating another injury with heat. And so that's a bigger wound that creates a bigger wound healing response, and you get a little bit more improvement with that.